More than 114,000 Americans are waiting for an organ transplant right now. And the vast majority of those patients need a kidney. But there just aren't enough donors. Has some doctors asking, could you use a transplanted organ more than once? Take a look at this.
About 20 to 25% of patients who have a kidney transplant die with a functioning kidney transplant. That's a lot of potential kidneys that could be put out there in the pool.
That's Dr. Jeffrey Veale, who's become a leading voice in this groundbreaking procedure. By transplanting a kidney that was previously transplanted, Dr. Veale is saving people years of suffering on dialysis.
I had just resigned to the fact that I would never receive a kidney, that I would just spend the rest of my remaining days, which I was thinking wouldn't be long, on dialysis.
There was a teenage girl who died tragically, and her family donated a kidney to a young man in his 20s. 2 years after his kidney transplant, he died in a motor vehicle accident. I didn't want to see a teenage girl's kidney just get discarded.
That's when Dr. Veale performed this astonishing surgery. This rare operation has now given her a new outlook on life.
I'm 70 years old, and I never thought that I would have a second chance in life, but thanks to you. I feel freer, and I know I'm on the road to a more fulfilled life.
30 million people in the United States with chronic kidney disease. Even if it saved 5 lives, even if we did this and it saved 5 lives, can you imagine if it was your life on dialysis?
The director of the UCLA Kidney Transplantation Exchange Program, Dr. Jeffrey Veale, is here in the audience with us. Welcome.
Thank you.
Dr. Veale, this sounds like such a game changer. Why aren't we seeing more of this being done? I know you're one of the few who's done it.
Yeah, I'm trying to get the word out there because there's a lot of kidneys like this that could be retransplanted. There's a lot of unrealized life years left on a 17-year-old kidney that's been in one person for 2 years. Let's retransplant to the next one. I think the big issues is that the surgeons don't always want to go back in after as you know well, after a previous surgery. There's scar tissue, so it's more difficult. It takes more time. My argument is just go have a big breakfast and get on with it and put the extra effort in. And then there's a concern if they're going to work. You know, this kidney has been through 2 death events. It's been on ice twice. And then the concern is if you retransplanted it into a third person, is it going to work? But, you know, Ms. Boyce's evidence, it's worked well. We've done this 3 times. All patients are off dialysis and their kidneys are functioning beautifully.
That is remarkable.
Is it harder to match the kidney in a regifted situation like this?
It is because the first donor, the original donor, actually died 2 years ago, so you don't have the blood to do the match. But now we can do it virtually on the computer. And the most beautiful thing about this case is that the original donor was a Caucasian teenage girl who donated to a Latino man, who then donates to an African-American woman.
Fantastic.
They were, you know.
I love it, the chain of life.
Yeah.
Now, if your name is gonna go onto the registry for a new organ, is there an opt-in feature to be put into the registry for a retransplantation like this?
No, it's you know, Miss Boyce or Vertus, she was kind of the next to get this kidney. You have to do informed consent. And so I just spoke with her on the phone saying, look, we're not sure if it's going to work or not, but it should work. It's a young, high-quality, original kidney. But she didn't have to accept this kidney. She could pass on it, and then it would go to potentially the next person.
Dr. Veale, part of the informed consent with a retransplant is that it doesn't last as long. Is that correct?
Yeah, I mean, there's been so few, and we don't have the long-term results. I mean, who knows? I'd love to be back on the doctors in 10 years with Miss Boyce and say, look, we got 10 years out of it. Who would have known? Maybe 15. But there's a chance that this kidney may only function for 4 or 5 years. The thing is that about 50% of people die on dialysis after 5 years. So it's not like being on dialysis is like how we're living. And so even if Miss Boyce got 5, 6, 10 years out of it. She's also visited her family in North Carolina that she hasn't seen in a decade. I mean, there's a lot of quality of life that she can get off this kidney, even if it functions for, say, 10 years instead of 15 years.
You know, what a game changer for Vertus. I mean, she has a second chance on a third-hand kidney.
It's amazing, and the way that Dr. Veale practices medicine is the correct way to practice medicine. You're taking a risk. It's a calculated risk. The patient has informed consent. They know what they're signing up for. So, yes, it's a little bit of an experiment. The patient's aware. They understand the risk, but they're getting some really good benefits out of it. This is the right way to practice.
And Dr. Veale, thanks so much for coming today, sharing this unbelievable story, and
Thanks for having me.
keeping our fingers crossed for Bertus. What a great lady.
Thanks so much, you guys, for featuring.
Stick around. We'll be right back.